I should probably say that, I mean, yes, I'm at UNSW, but I have also been in Sweden and Stockholm for quite a little while, so it's not entirely fresh, and I haven't traveled the entire distance, although I feel a little jet lagged because I took a very early flight today. But let me just, so there was a bit of an introduction, and I saw there is actually a biography, but what I was missing a little bit of the speakers is their background and what they have been doing in AI before. So that's why I actually spared one, or before I go there, actually, I just briefly give you an overview of what I'm going to talk about. I mean, a quick introduction of myself, and then a little bit about what AI does in health, and then also the two organizations that are involved in Sweden and in the Nordics at the moment. All right, so let's talk a bit very briefly about my background, just because so you know where I'm coming from. So I've been working with AI a very long time. I have a PhD in AI. I was receiving my PhD from the Faculty of Medicine and IT in Australia, and I have degrees in psychology and theoretical computer science, and so I've been applying AI in many different areas. And right now, I'm running a company called Healthy Habits that we'll talk about a little bit more later, but we're using AI to help people with a chronic condition to help each other and support each other in making better decisions. I'm also, we started an institute that is helping startups, governments, and larger organizations in using AI in an effective way. And I'm an adjunct associate professor at UNSW and also research at Karolinska. Before I was involved in some companies like IBM, British Telecom. So you know a little bit about this. And then perhaps I asked before, I mean, who has been doing AI? Who would consider themselves being an AI, you know, someone that uses AI? Hands up. Okay, so very few. So maybe then it's actually a good slide. I mean, some of you have heard of it, but I think it is worth to see. I'm just checking the time too. I don't have any time idea here, but what most of you know is big data and machine learning, but AI is also much broader. It has to do with robotics, it has to do with many other areas. And if you talk to people, AI researchers, they really want to build a machine that is autonomous, that can do many more things individually, and that can sort of have their own identity in some sense. And actually, recently, I have now an example in my head. The Arbetsförmedling, the employment office in Sweden, apparently gave an AI bot a personal number recently. So you see where things are moving a little bit. But AI is a very large field, and it becomes increasingly feasible to apply AI these days. You see these humanoids doing things. You see big data becoming predictive about chronic conditions, for example. So it is actually something that is becoming real. And AI has been around for 50, 60 years at least. Now it becomes more into our reach. Yes, and also I thought maybe a few words just to make sure what we mean by health. It's a very complex environment, and I think there's a bit of confusion of what it actually is exactly. I mean, there's a healthcare system. When you look at the WHO, they actually have a very broad definition of what health is actually about, and it is about your physical, mental, and social well-being, and it's delivered and supported by everyone in society, not just the big organizations, but people around you, the community, yourself, and that is an important consideration, because the complexities are not only in healthcare, in the healthcare system, in clinics and pharmaceutical companies and so on, but they also lie very much with the people themselves and people that have a chronic condition and how they can support each other. It becomes a real issue now, as most of you know, because of aging and lifestyle, and chronic conditions and long-term conditions are one of the biggest issues that we are facing right now. So taking these two things, in part it made me also start this company, because when you have this pattern where you see data and tech becoming more advanced and more powerful by the year, and you see at the same time that the healthcare demands are not met, so there's a real need in society to meet these problems that people have, this chasm will start creating. This is a beautiful space for entrepreneurs to be in, because at some point you really need to move away from these old style systems to today's novel digital health environment. And I think that's an entrepreneurial opportunity, really. So in short, because we have only a few minutes together, I think the biggest advantage of using AI in health is that you can deal with tedious complexities. That's one of those benefits that you have. So when you, for example, are a doctor and you're seeing a patient, you need to focus on that patient for those 10 minutes. There's usually a lot of data that lies behind that patient, either with that doctor over a period of 10 or 20 years, or also from other doctors and clinics that have been treating the patient, as well as what happened in that person's private life. So that is practically, and then the doctor does not only have to assess that type of data, but that doctor has to stay up to speed with all the the newest and latest in medical science, and that is practically impossible to do for an individual. And there is a bigger demand for people to have a personalization, so taking lots of different data sources and getting actually very good care, having not your 50 minutes a month with your doctor, but actually having information delivered to you which is very meaningful. And in order to do that, so going away from the general guidelines to specific information that you can use on a regular basis, you need personalization. The second aspect is scalability. So once you do have algorithms and a system in place that can deliver that personalization and that information to patients, clinicians, and the management at hospitals, for example, it's a matter of making it a broad solution for many. So to make it a mass customization, if you want to call it. And that's really where AI shines. That's one of the areas where AI really has big potential. So some of these tedious areas, I divide them roughly into two areas. And we have these emerging trends, which is digital health, digital medicine, therapeutics, diagnosis. Some of them we have mentioned and heard about today. And the more known areas are, obviously clinics and decision support. And you have systems that were in place in the 70s to start helping doctors making better decisions. Yes, I just mentioned that quickly. I think many of you have seen this slide. Who has seen this? Hands up. It's essentially an overview of all the startups that are working in AI and are transforming healthcare with AI. So they are more and more coming. They are applying different AI technologies, and it's a growing area. Okay, so the talk's title was Pushing Boundaries, so I might talk a little bit more about it. Andrew Nung is one of those colleagues of mine who's talking very much about how AI is becoming very important. It is a key in any company in the future because you need to start dealing with complexity, and if you do not have AI on board of your company's strategy, you will fall behind. And so I do like the approach that Andrew has, where it becomes increasingly important to have an absolute expert in your own organization, in part to have a deep technical understanding, to have non-trivial machine learning algorithms in your company, so you make the most of the data that you have, you make the most of the complexity of the systems that you deal with, and also to start actually making a proper assessment and the difference between all the different brands that are offered by different types of companies and the technology and the science that is behind it. These are two different things. So I don't want to name any brands, but that is something very important to consider. Another one is, of course, and actually I should have started perhaps with this metaphor that Andrew is using, which is like 100 years ago we needed the vice president of electricity because electricity was so new, you couldn't actually, a CEO wouldn't be able to assess which type of machinery and technology is the right one to use. And it's actually the same today with artificial intelligence. You need people in-house that assess properly what's the right technology to use and what impact it has on the business. If you don't have that, then you're actually really short on assessing what's a good strategy forward. Yes, and so maybe two more slides. With some colleagues, we built the Nordic AI Institute. We offer thought leadership in AI and health. It started as a non-profit, and we are wanting to really help provide more insights in that area. We have already advised, governments, but also startups. So more and more startups look at data that they collect or a new technology that they build, and we can actually help them to make more sense of that. Okay. And also pharmaceutical companies, a number of people in the healthcare sector actually looking at that too. What we can do is to help you make more sense and see the potential in your organization. Are you ready? Is your data ready? Do you have what competencies do you need? What would be a successful project that you would want to execute in your company? So that's one, and you can always approach me or visit our website. Now the website is not here, but it's NordicAIinstitute.com. And a more important one here is really that I'm also the CEO of Healthy Habits, which is located in Stockholm at H2, the Health Hub. Is Paul here, the CEO? He's up there. It's a very great, it's Stockholm's primary hub for healthcare and digital startups, so you should visit. I'm sure we can offer a coffee and so on in Stockholm. We are sitting there, and it's a startup that is offering patients and people with a chronic condition a way to connect with each other, to exchange information, and to motivate each other. And we are using artificial intelligence in a way that it doesn't become a forum where information is becoming very big very quickly, where you don't see when people post and exchange things what's relevant for you and what isn't. We personalize that experience. So we actually make sure that the information you receive and the people that you are together with is relevant for you. And that is in part because the healthcare system today is not particularly good at helping people with a long-term condition. Many people feel alone. Many people feel alone with the decisions they have to make. And so that is something we're very keen on promoting. Yes, and we are the leading company in digital therapeutics as an AI company. That's worth saying. We are looking for people, so if you are interested, talk to me also. We need someone that's heading the marketing and sales and the product and tech team. Yes, follow us on Twitter if you like. We are very active. We will, in fact, and the big announcement is really that we launch the product shortly, probably this week. So look us up on the App Store soon. If you are interested, if you can even do that if you do not have a chronic condition. But that might be something interesting for you to look at. Yes. And I think I leave it there because I wanted to make sure we have a bit of time for some questions.
We are in Finland after all.
Yeah, I was about to say, come on, Finland, you have questions, I'm sure.
There is one on there. Do we have a microphone somewhere? Or you have to shout?
Yeah.
The mic is coming though, just a second.
I can hear you, but now he has the microphone and the others can hear too.
All right, I guess now it's better. Thanks for the presentation. I actually work a little with the robotic system.
Mm-hmm.
But interesting was you were talking about motivation in your company actually.
Mm-hmm.
I was wondering, how do you make a product out of the motivation when it is something maybe more spiritual? Although you said the data is in the forum, people talk about it. But I'd be glad if you can talk a little more how to make it real for the people who are really maybe disappointed in that sense.
I'm not entirely sure what you mean. You mean the motivation as an out of motivation? Do you talk about healthy habits now?
Yes,
yeah.
For instance. Do you create healthy habits so that people can follow them?
Yeah.
Or do you create the initial motivation for the people so that they can grab what they need and then look for it?
Right. Okay, so Healthy Habits is a platform where what happens today if you have a chronic condition, you have diabetes, two type 2, for example, which is our first target group, then what happens is you usually get your diagnosis, and you stay with a doctor, you get generic guidelines and information, but then you're on your own. So you have to make decisions yourself. You have to stick to new guidelines or to your own guidelines. You have to perhaps lose weight or stop smoking, all these types of things. So if that's what you mean by motivation, perhaps, yeah, then one part of you making a behavioral change is that you have that information readily available so that you can actually make a better choice in the future. So and that information is not available today. The generic information that you get from the doctor's office is not telling you something about where you can buy lunch, for example, in the city when you meet someone, which is suiting your preferences and your goals of losing weight, for example. So part of the motivation, or to enable behavior change, is to give people that information to, let's say, execute easily on their motivation. And perhaps another thing, maybe more on a higher level, is that Healthy Habits really tries to keep a balance, or like keep a right balance between the unhealthy decisions that are easy to make today in a stressful environment, where you perhaps, buy bad foods and do other things, and make it easy for you to make the healthy decisions. And so one very important factor is that you have that information at hand, just as you would use Google Maps or Google Search today. In order to find certain things. You should use Healthy Habits in order to find information that will enable you to execute on your motivation and achieve your goals. So I'm not entirely sure if it answers your question, but otherwise, happy to talk afterwards too.
Thank you, Christian. We have to cut you off now.
No worries.
Thanks for the good presentation.
Thank you.
And our next speaker does not really need much of the presentation.